Okay, it's 4:03. It looks like things are slowing down a little bit with the waiting room, so we'll go ahead and get started. And again, I'd like to thank you all for joining our workshop. This is our third workshop, and I'm going to move something here. There we go. And my name is Jeff Williams. I'm the lead staff for the updates on our NO2 indoor guidelines. And before we begin, I'd like to introduce our branch chief, Bonnie Holmes-Jen, and she has a few opening remarks. So with that, Bonnie.
Thanks, Jeff. I'd like to welcome all of you and thank you for participating in our third workshop about updates to our indoor air quality guidelines for NO2. We are excited to be moving forward with this process to establish more health protective guidelines. And I also want to make sure to introduce our division chief, Elizabeth Sheely, who leads our agency's research program. So you'll see her a few squares over. Protecting public health from indoor exposures is a key priority for the Air Resources Board. We're proud of the work we have accomplished over the years to help inform the public and reduce indoor health risks. We're glad to be building on the foundation we established in our indoor air quality report to the legislature in 2005 that included the initial guideline levels. And we're really pleased to be working closely with our partner agencies that are represented here also. We'll start off the workshop with our staff presentation by Dr. Pat Wong and Dr. Jeff Williams, providing background information about why this update is needed and important information about indoor air quality and the health impacts of NO2 exposure. And we will also review information gathered from our previous two workshops and share what we learned and how this information has formed the basis for our proposal. So we'll then present our proposed approach and proposed levels and discuss the benefits and challenges we've identified in our next steps. And after our CARB staff presentation, we'll hear presentations from our partner agencies working on related issues, Dr. Maninder Thind from CEC and Dr. Kazu Kamagi from CDPH. And so they will share some updates on their programs related to indoor air quality and guidelines work that's ongoing. After the presentations, we will then open up the workshop for comments, questions, and general discussion. So thank you again for attending. Again, we're excited about this step forward, and I'll turn it back over to Jeff and Pat, who are going to start the presentation.
Great. Thanks, Bonnie. So let's see. There we go. All right, before we get started, I do have a few housekeeping items, and this is just to keep things running smoothly for the workshop. Now, if you'd like to make a comment, we ask that you keep it under 2 minutes, and you can also submit comments at the link on the slide. We will have a timer, and Zoe will let you know if you're getting near the end of your time on your comment. If we do not get to your question during the QA period at the end of the presentation, you can submit it via email to iaqguidelines@arb.ca.gov. Now, if you're having any difficulties with the functionality of Zoom or any problems, you can email Christy Hall at christy.hall@arb.ca.gov, and she'll do her best to assist you. We are recording this meeting and we'll post the recording to our website once it is uploaded to YouTube. We also posted the slides from today's workshop. Finally, we'll send out an email to the registered participants if there are any updates to share. Now, the chat will be for CARB to provide links and other information. And if you'd like to submit a written question, please do so by clicking the Q&A icon at the bottom of your screen. You can type the question in the panel on the right-hand side of the presentation window. If you want to ask a question live, you're welcome to raise your hand and use the raise hand feature by clicking on the reactions icon at the bottom of the screen. We'll have time for questions and comments at the end of the presentations. We will call on you to ask your question and unmute when it is your turn. When called on, please identify yourself and your affiliation and let us know if you have a question or comment. This is our agenda for the day. Pat and I are going to start off with a presentation about the background and objectives for this workshop and briefly review what we've learned in the previous workshops and then discuss the approach that we are considering for updating the guidelines. We'll then hear from our guest speakers, Dr. Kazu Kumagai from the California Department of Public Health and Dr. Maninder Thind from the California Energy Commission. After our presentations, we'll move into the question and discussion portion of the workshop. We hope to get your thoughts about updating the guidelines, technical advice about any potential benefits or drawbacks to the respective approach, and any other comments that you'd like to share. At the end of our Q&A, we'll have some brief closing remarks about next steps before we adjourn. Okay, with that, I'll go ahead and get right into the actual presentation. So the California Air Resources Board is proposing to update California's guidelines for the indoor levels of nitrogen dioxide. CARB first established indoor guidelines back in 1994 when we published a document titled Combustion Pollutants in Your Home. Now, these guidelines were retained as part of CARB's 2005 report to the legislature on indoor air quality. Since that 2005 report, agencies such as Health Canada and the World Health Organization have adopted more health protective indoor guidelines for NO2 and other pollutants based on more recent studies. Since then, we've seen increasing calls for action from community-based organizations for updated guidelines. Vulnerable communities are at greater risk of exposure to high levels of indoor NO2, and these guidelines will help them to understand what indoor levels are protective of health. The benefits of updated guidelines will be an evidence-informed tool to provide guidance for indoor air quality policies, the development of less polluting appliances, updated building codes, and other mechanisms to achieve greater reductions in indoor pollutants. Guidelines will also provide a benchmark against which future IAQ research can establish health-based evaluations of indoor environments. Now, just to set the context for this talk, I think it's first helpful to discuss the differences between guidelines and standards, especially when it comes to regulatory actions. Indoor air quality guidelines are voluntary benchmarks for safe concentration thresholds for indoor air pollutants. And essentially, these are just recommendations that CARB believes should be met to protect residents against health impacts of specific air pollutants. Now, in contrast, air quality standards are enforceable. The maximum concentration levels in outdoor air set by CARB or US EPA. These are also health protective, but are mandatory levels, which areas in California must attain to comply with these standards. States must implement pollution control measures to achieve these levels. So why does NO2 matter? Well, NO2 is a harmful air pollutant that poses serious health risks, especially for children and individuals with respiratory conditions. In California homes, NO2 exposure is primarily caused by indoor combustion appliances like gas stoves and heaters. Indoor NO2 concentrations are often higher than outdoor levels, especially in poorly ventilated spaces. In addition, it's estimated that the average Californian spends approximately 90% of their time indoors. A professor and Nobel Peace Prize recipient Kirk Smith highlighted the exposure implications of these facts when he stated that an amount of pollutant released indoors produces about 1,000 times more exposure than the same one released outdoors. Of course, this can vary by situation, but this is generally applicable. Although we tend not to think of our homes as sources of outdoor pollution, the reality is that NO2 and other pollutants that are generated indoors from vented and unvented appliances impact both our indoor and outdoor air quality. There's an extensive body of research demonstrating the health effects of exposure to NO2 through multiple lines of evidence, such as controlled exposure studies and epidemiological studies. Causal short-term effects of nitrogen dioxide exposure have been demonstrated in controlled exposure studies. These studies have shown that nitrogen dioxide can aggravate respiratory diseases, particularly asthma, leading to respiratory symptoms such as coughing, wheezing, or difficulty breathing, and hospital admissions and visits to emergency rooms. Epidemiological studies that have followed long-term exposures to elevated concentrations of NO2 have found that it's associated with the development of asthma and may increase susceptibility to respiratory infections and increased mortality, particularly in children and the elderly. A recent study by Cashton at Stanford estimated that gas and propane stoves increase long-term NO2 exposure, and that increased exposure likely causes approximately 50,000 cases of current pediatric asthma in the US. In the United States, there's a paucity of guidelines for indoor air quality, and we're seeing federal and state agencies around the country also pursuing the development of new guidelines or updating existing guidelines. Here's a brief summary of some of the efforts being made by other agencies related to indoor guidelines. Now, although the California Energy Commission is not developing guidelines directly, they are funding a significant amount of research to investigate the impacts of combustion appliances and ventilation in indoor air quality. We're going to hear more about indoor air quality and current health research that is being done during Dr. Thin's presentation that will help support the basis for our guidelines. The US EPA has indicated that they are pursuing the development of indoor guidelines, and they're focusing their initial efforts on PM 2.5. The California Department of Public Health is also exploring the development of indoor guidelines for PM 2.5. And in fact, I'm part of the CDPH task force that is working on the PM 2.5 guidelines, and the work's complementary to the efforts here at CARB. Dr. Kumagai will provide an update of the CDPH guideline work in his presentation. Finally, the Consumer Product Safety Commission convened a task force of industry and consumer interest groups to make recommendations for voluntary standards and for code bodies to improve IAQ in homes from pollutants emitted by gas ranges. A working group within the task force has recommended adopting the Health Canada Residential Indoor Air Quality Guidelines. This is a snapshot of the current guidelines from CARB, along with those from Health Canada and the World Health Organization. Now, currently, CARB's 1 hour and 24-hour guidelines, which are 250 and 80 ppb respectively, are significantly higher than the current Health Canada and WHO indoor guideline levels. I should just note that the 2010 WHO 1 hour value of 106, that was actually retained from their 2005 assessment. Now, this figure provides it's a broader look at different guidelines from around the world using the database compiled by the International Society for Indoor Air Quality and Climate. The figure provides a better context about where the existing CARB guidelines fall in comparison to guidelines from other countries. And you can see that for both the 1 hour and for the 24-hour guidelines, the current CARB values are significantly higher than the others. This is a timeline of our guideline development process so far. We started the process in early 2023 and had our first workshop in the spring of 2023 and a second workshop in 2024. And we took the information from those workshops to determine the approach that we're going to discuss today. After the workshop today, we'll take the information that we've gathered to develop our IAQ guidelines document, which will then go through an internal and external review process. And we hope to have the guidelines finalized and the document released to the public around the summer of 2026. So just quickly, I would like to do a quick review of our first two workshops. And in our first workshop, we invited representatives from the WHO, Health Canada, and others to present on their experience and processes for developing indoor guidelines. In addition, we heard perspectives from the California Department of Public Health, OEHA, and the Energy Commission. We also invited participants from community organizations such as We Act, Physicians for Social Responsibility, and the Central California Asthma Collaborative. We rounded out the workshop with technical experts from academia and the health sciences. Now, the key takeaways from this workshop included that community groups and researchers acknowledge that better guidelines are needed, also that combustion appliances are the primary source of NO2, and concentrations during cooking can exceed 100 to 400 ppb, which is far above health-based thresholds, particularly in homes without proper ventilation. Children, the elderly, low-income households, and communities of color are more likely to live in smaller, poorly ventilated homes with gas appliances. That increases their risk of asthma and other health issues. Mechanical ventilation, like range hoods, significantly reduces NO2 exposure, but the usage is low, and maybe only around a quarter to a third of people use them. Source reduction is the most effective measure, but it must be implemented equitably. And finally, participants emphasize the need for early involvement of community-based organizations, tenant protections, and accessible programs to ensure that updated guidelines benefit those most at risk. For our second workshop, CARB staff discussed 3 proposed approaches for updating its indoor air quality guidelines and solicited feedback from stakeholders, such as community groups, researchers, and agency partners. The stakeholder recommendations were that we should maximize health protection and use Health Canada's work as a foundation. That's to save time and to save resources. To frame our guidelines as targets, not mandates, and that's to encourage adoption. To collaborate with CBOs for outreach, education, and implementation, support development of low-cost NO2 sensors and smart range hoods, and consider multi-pollutant impacts and co-benefits of electrification, such as reduced PM 2.5 or GHGs. All right, well, with that, I'm going to hand over the presentation to Pat Wong, our manager of the Building and Indoor Environment section. And he's going to provide more details about our approach to the updated guidelines. Pat?
Okay, thank you, Jeff. Based on a review of the health impacts of NO2 and input we received from the public and workshop participants, we decided to develop our guidelines to be as health protective as possible, especially for sensitive groups. Therefore, we based our updated guideline values on the Health Canada reference concentration, or RFC, that were the foundation of their indoor air quality guidelines. Basically, the RFC is a scientific estimate of the level of a pollutant in the air people can breathe over a specific averaging time without expecting harmful health effects. It is based on toxicological and epidemiological studies and includes safety margins to protect sensitive groups. You might consider it as a level to define safest exposure levels. CARB staff reviewed more recent studies to see if there was a need to further adjust baseline levels for NO2 health impacts. We found no evidence that a lower baseline value would be necessary. Using these methods, we're proposing indoor air quality guideline levels of 27 parts per billion for 1-hour exposures and 5 parts per billion for 24-hour exposures. The main benefit of these levels is that they are the most health protective and based upon robust science and methodology used by OEA and other international agencies. The main challenge would be that it may be difficult to achieve in some homes while employing NO2 mitigation strategies. The key study which was used for the derivation of these guidelines were based on exposures to asthmatic children, which demonstrated higher frequency of days with respiratory symptoms and or medication use. Therefore, we feel that setting our guidelines at these levels would provide the maximum health benefits for these and other vulnerable populations. We feel that this process for updating the NO2 indoor guidelines will have multiple benefits beyond establishment of guidance of what CARB considers is a health protective level for indoor NO2, especially for children, seniors, and people with asthma. First, it provides a better clarity for stakeholders such as homeowners and environmental health officers on what level should be aspired to in a typical indoor space within buildings such as California homes and schools. This in turn can inform product emission standards, not just for gas stoves, but for all indoor combustion devices, filters, and sensors to help achieve these target indoor levels. Additionally, these guidelines can support and inform Title 24 and ventilation code updates, modernizing standards to reflect the latest information from scientific studies. And finally, these updated guidelines can help incentivize the adoption of cleaner, more efficient appliances, accelerating electrification and innovation in a way that benefits both public health and climate goals simultaneously. Achieving the guideline values will necessitate that we address indoor air source contributions. The whole hanging fruit for indoor emission is, of course, combustion appliances, and using low emission appliances or zero emission equipment will be a big first step to achieving the guideline values. Also, minimizing the entry of outdoor pollutants into the indoor space and creating an indoor environment where air is significantly cleaner than outdoors is ideal, particularly during exceptional pollution events such as wildfire smoke. Behavioral modifications like avoiding smoking indoors and the increased use of range hoods while cooking can help reduce not only NO2, but PM and other pollutants as well. Ventilation with uh, with clean air is another key control strategy to remove or dilute indoor contaminants. Better monitoring of ventilation and use of filtration in public buildings will help ensure that clean air is delivered and circulated properly in indoor spaces. This could be particularly effective in better controlled environments such as office buildings and schools. Monitoring poses a technical challenge right now because indoor NO2 is highly variable, and consumer monitors that are considered low cost do not reliably measure NO2 at the level of the new guidelines. However, facility managers in larger buildings and schools who have access to higher quality monitoring equipment will be able to establish baselines and follow their indoor air quality in real or near real time to reduce indoor pollutant levels. This slide outlines the next steps that we plan to take after the workshop. This includes completion of the draft guidelines document, which will be subject to internal CARB review before release for the public external review, including outreach to expert reviewers. The guidelines will be updated to address comments based on feedback from external review and then published after approval from CARB's executive office. Now, back to Jeff to present our speakers or introduce our speakers.
All right. Thanks, Pat. I appreciate that. And all right. So I am now going to hand over the workshop to Dr. Kazu Kumagai from the California Department of Public Health. And after him, we'll have Dr. Maninder Thin from the California Energy Commission. And they're going to provide updates on their programs related to indoor air quality and indoor guidelines. So to start, I'll introduce Dr. Kumagai. He is the chief of air quality, the air quality section of the California Department of Public Health. He's also an affiliate scientist at Lawrence Berkeley National Labs and adjunct professor at Tokyo University of Science. Dr. Kumagai holds a bachelor's and master's of architectural engineering from Tokyo University of Science in Japan, an MPH in environmental health science from the Institute of Public Health, Japan, and a PhD in environmental science from the University of Tokyo. And Dr. Kumagai has worked for over 20 years in the field of environmental health and engineering. His interest is on air quality monitoring, exposure assessment, developing, evaluating exposure reduction technologies applied in indoor and outdoors, and research driven by air quality policy. And apparently collecting degrees. You have a lot, Kazu. So I will turn it over to you. I'm going to stop sharing, and you should be able to go ahead. And if you do have some slides you want to share, you can go ahead and share them now.
Let's see. Thank you, Jeff. Can you see my slides?
Looks great.
Okay. Thank you, Jeff, for the kind introduction. My name is Kazu Kumagai. Again, I run the air quality program at California Department of Public Health. But today, instead of just mentioning about my current affiliation, I just want to say that the talk that I'm going to give today is a joint effort by the Governor Gavin Newsom's Smarter Plan Task Force, IAQ Task Force team. And we will touch a little bit about what the task force have been worked on in the beginning, and then later I will give you some updates about the IAQ guideline development, especially focusing on PM 2.5 right now. So rewinding back to the COVID era, which we want to forget about, but going back to that era, COVID really exposed us about how building facilities and HVAC systems are poorly maintained, and maybe because the reason for that could be a lack of a regulation standard or guideline on indoor air quality. And because there's no regulation or standard, no one is enforcing it. When it comes to the awareness, when during COVID, people had other things to be aware of, also during normal times as well. And if there's a lack of awareness when it comes to fighting for the budget, it usually the priority of it usually goes down, and that trickles down to like the health equity problem that we faced during COVID. To respond to this issue, on behalf of the Governor Newsom, um, uh, Secretary of Health and Human Service Agency, Mark Galley, invited the state IAQ experts to help us do something about this poor indoor air quality issue. So this is a copy of the letter, and in it, it specifically states to develop a new educational resource for public on the benefits of improved indoor air quality. Second, it asks us to provide recommendations on approaches to reduce indoor air transmission of respiratory pathogen and improve indoor air quality that will be summarized in the report. Third, to lay out a roadmap for developing state IAQ standards or guidelines. So this will be, I will talk about this later. And then lastly, it tasks us to issue innovation award to promote innovation in effective low-cost approaches to improve indoor air quality. Later on, we decided to not to work on the item 4, so I will talk about the 3 items that's listed here. First, the letter went to multiple agencies, and here's a list of the agencies that agreed to participate in the task force. CDPH is just a host of the task force, but as you can see, there are 9 other agencies that participated in this task force. Some products from the task force. One is like a booklet developed by a school district to promote better indoor air quality. So you could find this on the website. Another is a set of videos that was developed by the folks at UC Davis to train the workforce to improve indoor air quality. So these are the 2 products that that's already out there so that you could find them on the website. Another work is we didn't directly work on it, but one of us participated on developing a ASHRAE standard to control the infectious aerosols. And we're trying to explore whether we could implement this ASHRAE standard into to operate and maintain our buildings in California. And then we wrote a report on some recommendations. So I'm not going to read all of them, but basically what it's saying is we need better ventilation standards. We need to adopt a standard how to use portable air cleaners. And then the third one in red, you could see we listed to develop a IAQ guideline for specific pollutants. And the rest I will not go over, but these are kind of the highlights of the recommendations in the report. So then about the regulation standard guidelines, we looked into what kind of regulation standards or guideline we have in California. Some are on building construction. There are a couple of others on ventilation. Also, there is something on building material emission testing and emission criteria. And from CARB, for example, they have a air cleaner regulation. For the existing buildings, there is a statement on building dampness, mold, and health. But to summarize them, majority of them only touches the source control or building commissioning or ventilation design, which is for the pre-occupancy of the buildings. And what's lacking is what needs to be done after the building was built or after a major renovation, or in another way, during occupancy. So let me stop here first. I'm sorry, I have a technical issue. So you no longer see my slides, right?
No, and I'll just go ahead and I'm just going to reshare the
No, no,
agency
no,
update
no, no.
slide.
It's
But yeah, you keep going.
yeah. I will keep going. So going deep onto the PM guideline, we decided to work on PM 2.5 among various pollutants for a couple of reasons. Um, the biggest reason is there's a lot of reports that mentioned about the negative health impact caused by PM 2.5, and it's usually ranks the highest among other indoor pollutants. So that is one of the biggest reasons why we chose initially to work on PM 2.5. But in addition to that, if we tackle on PM 2.5, that could help us reduce airborne pathogen infection. Also, in California, we have wildfire annually now, so it could help reduce exposures to wildfire smoke. There are measures to reduce exposures from PM 2.5, like ventilation or filtration. So the technology is already there. And we are aware that the public are using a lot of low-cost sensors these days. So in a way, we kind of agree that we need to have some sort of a answer to what those readings from the low-cost sensors means. So that is the reason why we first chose to work on PM 2.5. The procedure of this task force was first we did a deep dive into a database developed by an organization called ESIAC, which stands for International Society of Air Quality and Climate. So they have a database on uh, the indoor air quality guidelines or standard worldwide, and we could sort them by pollutants. So we did a deep dive on what numbers the other countries are uh, using, and whether they have a clear rationale or not. Um, and then after that, we found out that there wasn't much good reasons of a lot of countries choose for the PM 2.5 guideline. And then after that, we kind of narrowed down to the three reports or guidelines that has been issued around the world. So one is from the World Health Organization, another one is from Health Canada, the third one is from US EPA. But the US EPA one only mentions about outdoor air PM 2.5, so that in a way that kind of kicks it out from our review process. And then later, and after that, Health Canada's guideline, it concludes that they cannot draw a threshold for a PM 2.5 PM 2.5. Instead, they're calling it ALARA, meaning as low as reasonably achievable. So in a way, that also doesn't mention any numbers for PM 2.5. So that because of that, that leaves only the WHO number is the one that remained for us to kind of consider for now. I will not talk about the number itself, but next I'll briefly mention about what the guideline and the supporting material might look like. So first it'll mention about the scope of guideline and the guideline value. And then after that, we will mention about the rationale, like just like what CARB has been doing on the nitrogen dioxide. So it'll talk about the health effects, the sources, and other things. Um, well, and of course, people would wonder, how they are gonna implement the guideline if a number is announced. So we will mention about the implementation of the guideline number value. And we separated it by public buildings and residences or buildings without facility managers. Um, that is all about the document. And moving forward, we will take a little different approach from CARB. But first, before uh, requesting comments from the public, we wanted to make sure that the document itself is scientifically firm, concrete. So next step for us is to send the document to the experts, and then after that, we'll have our management from other agencies, sister agencies, take a look at it and review it, and then maybe announce it to the public. So we'll open it for public comments, and then hopefully we'll get the guidelines published maybe at the end of next year or middle of next year. But that's kind of the action items that we have in mind right now. So I will stop here. Thank you.
Great. Thank you, Kazu. Appreciate the update. Okay, so we'll go ahead and move on to our last presentation, and that's going to be by Dr. Maninder Thend. And Dr. Thend is an air resources engineer in the Sustainability and Health Research Unit within the Energy Research and Development Division at the California Energy Commission. He leads and manages a research portfolio focused on advancing equitable and health protective clean energy transitions in California, and his work spans outdoor and indoor air quality, human health impacts, and methane emissions from the residential sector. Before joining the CEC, Maninder earned his PhD in environmental engineering from the University of Washington, Seattle, where he modeled and quantified air quality, health, and climate impacts of various energy systems, including electricity generation, transportation, and agriculture. He also holds a master's degree in civil and environmental engineering from the University of Minnesota, Twin Cities. So with that, Maninder, I'm going to stop sharing, and you wanted me to run your slides, correct?
Yes, if that's possible.
Okay,
If not, I can share this.
no, it should be fine. I can go ahead and I'm going to stop my presentation. And if you guys will bear with me for just a second here, I'm going to go ahead and launch your presentation. Okay. There we go. Got it. Okay. Let's see. Okay, I'm going to start sharing. There we go. And let's see, I think this might have brought up my slides again, which I don't want. Here we go. Okay. Try this one more time. That looks better. Okay, does that look okay, Maninder?
Yes, perfect.
Great. Okay, and just let me know when you want me to advance the slides, and I will move them ahead. Thank you.
That sounds good. Thank you, Jeff. Yeah, thanks for the introduction. Good afternoon, everyone. I'm pleased to be here to share an overview of CEC-funded indoor air quality research with a focus on nitrogen dioxide, the pollutant central to today's discussion on CARB's indoor air quality guidelines update. Some of you may recall that I presented in workshop 1 on earlier CEC research and future research directions. Today, I will focus primarily on our ongoing and more recent work in this space. Next slide. Great. I would like to begin by briefly highlighting where our authority for indoor air quality requirements originates. The Warren-Elquist Act, which passed in 1974, established the California Energy Commission in 1975 and provided explicit direction to the CEC to adopt and implement energy efficiency standards for new buildings. Accordingly, CEC first adopted Building Energy Efficiency Standards, or Energy Code, in 1976, providing a key means for the state to implement energy efficiency in buildings. These standards contain requirements to safeguard ventilation and indoor air quality in newly constructed buildings and additions and alterations to existing buildings. And within the Energy Code, the ventilation and indoor air quality requirements derive their authority from the Health and Safety Code, which emphasizes protection of public health. So as homes have become more airtight for energy efficiency, natural ventilation has decreased, making mechanical ventilation increasingly essential. Prior field research, some of that funded by CEC, has shown that many Californians do not regularly open windows, further underscoring the need for reliable mechanical systems. So much of our early CEC's research efforts have delved into issues that impact ventilation-related requirements for the Energy Code. Since 2008, the Energy Code has incorporated residential mechanical ventilation requirements. These were updated in 2022 Building Energy Efficiency Standards, which are effective in 2023, to include health protective capture efficiencies and airflow rates for kitchen range hoods, with guidance from the CEC-funded research work, which I will also highlight later in the slides. And also, all buildings are required to install MERV 13 or better filtration to support cleaner indoor air. And CEC updates these standards every 3 years. Next in the line is to 2028 Energy Code, for which I think work has already started. Next slide. All right. I don't expect to go through all the detailed citations here, but I would like to acknowledge the funding programs through which CEC has supported important energy-related research related to air quality and health since the early 2000s. These funding programs include California's Gas R&D program and the Electric Program Investment Charge, or EPIC program. This slide highlights some of our publications, many of which included direct measurements of criteria pollutants, including NO2, using field, laboratory, and simulation approaches. Next slide. So the remainder of my presentation will focus on our recent and ongoing indoor air quality work relevant to CARB's proposed NO2 guidelines. Next slide. Right, so some of our early work before 2020 drove home the need for mechanical ventilation in new, tightly sealed homes. To get a sense for how well ventilation systems were working, we funded a survey and field study of 70 homes built between 2011 and 2017, which evaluated how ventilation systems were performing in new California homes with gas appliances. The study found that the measured concentrations were below health guidelines for most pollutants, including nitrogen dioxide, indicating that indoor air quality is acceptable in new California homes when mechanical ventilation is used. However, survey results indicated that labeling and controls for ventilation systems need to be improved. The survey results also indicated that the vast majority of California homeowners do not open their doors or windows in the winter, and a quarter of California homeowners never open their doors or windows regardless of the season. This indicates an ongoing need for mechanical ventilation, as a substantial fraction of the population does not open windows to provide natural ventilation on a regular basis. The research team also found that most of the ventilation systems were not upgraded because occupants were unaware that the system existed and did not understand the controls, which were typically not labeled. Next slide. Right. So this follow-up study published in 2021 focused measurements in smaller homes and in new and renovated low-income apartments. Measurements of nitrogen dioxide and fine particulate matter in apartments and houses with code-compliant mechanical ventilation suggested that in a substantial minority of homes, concentrations may exceed the health-based limits. For example, 3 apartments had indoor NO2 concentrations above the California um, ambient air quality standards during the week of monitoring. Additionally, formaldehyde concentrations were lower in apartments than in houses, but still was found to be routinely above the chronic reference exposure levels set by CARB. Study results also found that range hoods were used more frequently with cooking in houses, about 36%, than apartments, which was about 28%. This research found that minimum airflow requirements are inadequate to ensure sufficient pollutant removal and provided data to substantiate the use of capture efficiency in California building code as an improved metric for range hood performance. It provided direct support to 2022 building energy efficiency standards by adding health protective capture efficiencies needed to meet the 24-hour fine particulate matter threshold value and 1-hour nitrogen dioxide threshold value. Before this, there was no standard test or rating system for capture efficiency of residential cooking exhaust hoods. Capture efficiency depends on both the range type, gas versus electric, and home size within the standards, with homes under 1,000 square feet having more stringent requirements. Next slide. All right, so this was a more recent effort of field research that measured pollutant concentrations in about 76 homes across different seasons. And yet, once again, we see that the concentrations of nitrogen dioxide and PM2.5 in many homes exceed annual ambient health standards. More than 20% of the homes monitored during the winter sampling timeframe had NO2 levels above CARB's annual average air quality standard. And also, the residential electrification delivers substantial local air quality and health benefits, especially in under-resourced communities. And these health gains far outweigh any potential increases in emissions from marginal grid generation using the data and modeling that the study used. Right, next slide. All right, next I will highlight our ongoing work that directly examines the benefits of clean energy interventions in reducing indoor NO2 and PM emissions. Next slide. All right, so this is our current Civica project, or Cooking Electrification and Ventilation Improvements for Children's Asthma. This project was kicked off in 2022, and it's led by Lawrence Berkeley National Lab, is a randomized crossover intervention trial in California homes with asthmatic children. Other project subcontractors are Central California Asthma Collaborative, CCAC, UCSF, Association for Energy Affordability, and UCLA. This was our group's first effort to directly measure health outcomes of clean energy interventions among a target population. And the study quantifies how indoor air quality and respiratory health change when gas cooking is replaced with electric induction in homes that have working kitchen exhaust ventilation and have received education about using it. And homes are based in Fresno and Bakersfield. Each participating household has a child aged 6 to 13 years old with diagnosed asthma, and that the child has been enrolled and participating in CCAC's asthma program. The study uses a combination of real-time and integrated air pollution monitors to measure multiple indoor air pollutants, including nitrogen dioxide and PM2.5, at 2 locations within each home. One, a central location, for example, a great room containing kitchen or room next to the kitchen, and a child's bedroom. And children's asthma symptoms and respiratory health are assessed through the Pediatric Asthma Control Test, or ACT, Child Health Questionnaire, spirometry, and fractional exhaled nitric oxide measurements. The full results from the study are expected in 2027. Next slide. And here's the current project status. The cohort 1 of this study produced a robust and highly detailed data set. In cohort 1, 39 homes completed the arm 1 of study, which was replacing the gas stove with electric induction stove. And 10 homes completed the arm 2, which was an additional arm looking at the introduction of 120-volt electric appliances in the study. And the cohort 1 ran from January 24, 2024 through April 25 of this year. And the cohort 2 initial visits began in November 2024 with 52 enrolled and complete or participating to date. And cohort 2 should be mostly completed by March 2026, so next year. So in cohort 1, Lawrence Berkeley National Lab and the team intensively monitored for about 2,262 days across the 49 homes and derived about 3.2 million records at 1-minute intervals and detected over 4,000 cooking events in this work. Preliminary observations so far are for the 39 homes where intervention of replacing gas stoves with electric induction took place. Cooking frequency was consistent across gas and electric phases, which confirms the comparison is valid. Preliminary results also align with prior studies that suggest stove type, cooking time, and range hood use are top predictors for nitrogen dioxide. And the field team is seeing that range hoods are used in less than half of cooking events. And they are currently working to quantify this as they gather data. Preliminary analysis also shows substantially fewer and smaller NO2 events with electric cooking. And the team also developed an analysis plan for the indoor air quality data that looks at pollutant event characteristics, total pollutants added to the space during events, and integrated pollutant concentrations, and probes the relative impacts of cooking fuel, range hood use, and house parameters. Next slide. All right, this is our recently started study with gas R&D funds. We have the opportunity to support more work in the area of indoor air pollutant exposures. This is a field study led by Berkeley Air Monitoring Group, which was kicked off early this year to quantify and characterize residents' exposure to indoor air pollutants generated from kitchen stoves, gas and induction in California homes with a focus on multifamily homes and complemented by a sample of single-family homes, considering factors such as human behavior patterns and socioeconomic factors. This study will measure NO2 exposures and assess impact of other exposure factors, including housing geometry, cooking behaviors, and indoor and outdoor air pollution. And will also include a user-friendly data visualization tool for the residents at the end of the study. Next slide. This is another sister study led by LBNL, also kicked off early this year, supports a field study and data analysis to quantify and characterize exposures to indoor air pollutants, including nitrogen dioxide generated from cooking with gas, electric, and induction ranges in multifamily homes in low-income and disadvantaged communities in the Central Valley and Northern California. The study will capture information about the homes, cooking equipment, cooking practices, and use of mitigation, including ventilation, and will thus provide an empirically grounded framework to guide intervention policies, including electrification, ventilation standards, and improvements to installed ventilation equipment. Next slide. This is another study. This project led by County of Ventura with Frontier Energy was kicked off in June this year. Will assess the impact of consolidated and separate electrified retrofit measures on air quality, comfort, and other non-energy metrics in California homes, and provide guidance on how non-energy benefits can be implemented in decision-making to replace gas-fueled equipment with electric. The project leverages a 3C REN program for retrofit implementation and will measure NO2, PM2.5, and other pollutants in 100 single-family homes in Ventura County, San Luis Obispo, and Santa Barbara County. Next slide. All right, so moving to last two slides, I'm going to jump on to some of the common findings from the past research and the recent work. Next slide. All right, so the field-based research and modeling have both revealed that California homes with unvented gas-fired equipment can generate indoor concentrations of nitrogen dioxide that exceed health-based standards. Mechanical ventilation in kitchens, such as range hoods, when used, can help lower a nitrogen dioxide concentration to safe levels. As California Energy Commission demonstrated with 2022 building energy efficiency standards, it is possible to set scientifically informed ventilation standards that protect human health and avoid unnecessary expense on energy costs. The 2022 standards are structured with particular attention to safeguarding air quality in smaller homes that are typical for low-income communities. Though there are a few challenges, for example, old building stock in California represents an issue to which new requirements in the code does not apply. For example, in California, more than 90% of single-family detached homes and about 78% of apartments were built before 2012. Adoption is also an issue. Per 2019 RAS data, only 28% of single-family homes have electric cooktop at present. And there's a challenge of operational deficiencies that impact performances of mechanical ventilation systems in low-income housing. And to be noted, since pollutants are generated from cooking regardless of energy source, swapping gas cooking appliances with cleaner options does not eliminate the need for effective kitchen ventilation. However, as seen from the capture efficiencies required for electric versus gas ranges in energy code, the exclusion of gas helps to lower concentration of pollutants, principally nitrogen dioxide, and provides more flexibility in kitchen ventilation use. And there are other pollutants of high concern that need attention, such as fine particulate matter and formaldehyde, as they are found to be routinely exceed chronic reference exposure levels set by CARB. Next slide. All right. Some future research that we foresee in the future to be funded through some of our research programs. More research is needed to quantify health and related monetized impacts of electrification interventions to support building decarbonization and improve residents' health, characterize emissions, particularly ultrafine particles from cooking activities regardless of fuel type, and understand actual exposures of cooking-related NO2 and PM2.5 emissions to residents, for which the work is ongoing through our projects that just kicked off this year. And also develop ventilation and control strategies tailored for effective use by Californians, and also understand the empirical validation of health and indoor air quality impacts of California's new building energy efficiency standards when we have updates. All right, with that, next slide, just a thank you slide. Thank you for this opportunity. We really appreciate the cross-agency engagement and coordination with CARB throughout the process of updating the indoor NO2 recommendation, and we look forward to continued collaboration on our shared goals related to health, environmental protection, and energy decarbonization. So thank you so much.
Great. Thanks, Maninder. That was great. I mean, that's a really impressive list of projects that you guys have going. It's it's a lot to take in. And I'm going to relaunch our slides, but just a quick question while I'm doing that. I'm assuming most of those those electric cooking appliances were induction. Is that correct?
Yes.
Okay.
In the Civica study, it's electric induction
Mhm.
as the intervention. And I think in other studies also, though we'll get more clarity as the field work kicks off.
Right. Great. Okay. All right, let me go ahead and I'm just going to relaunch. I don't really have a whole lot to share other than just some slides to just sort of help keep things organized and prompts. I will say while I'm relaunching these, so if you have any questions, please feel free to enter a question in the Q&A. If you would like to ask something live, raise your hand and we'll go ahead and start taking questions. So let's see here. I'm gonna launch this and go to here. Okay. And I'm gonna just go ahead and go to the, I should have queued it up right. The very last slide here. Okay, let's go back here. There we go, questions and comments. So I did want to have a slide just for us for our presentation and to say thank you again, that if you want to email us with any questions, you can do so at iqguidelines@arb.ca.gov. We do have a NO2 dedicated NO2 guidelines webpage, and that's at the link here. Also, if you want to provide comments offline, you're welcome to at any time. Last meeting, our last workshop, we got a great set of comments from Nina Prescott and several agencies that provided a very helpful information to us. So we welcome your comments there as well. So with that, I'd like to turn it over to Bonnie Holmes-Jen. And I'm sorry, I'm just moving some things around here. And to open up the workshop for questions and comments. And again, Bonnie's our branch chief in the health and exposure assessment section. And basically, she's going to be the moderator for this section of our workshop. So Bonnie?
Thank you, Jeff. It'd be great if people could think about if they have any questions on the content of the presentations that you'd like to ask, any clarifications or questions. And then we could go into any general comments on the ARB proposal to update the indoor air quality standards for NO2. I would just note that there's a question in the chat about how can we get involved in the research. So I would just say, for ARB, I would encourage anybody, ARB also has indoor air quality research. We haven't had time to go into all the research that our different agencies are doing, but if anyone wants to get updated on our indoor air quality research or to get on a list to get updates, they should contact Pat Wong or Jeff Williams, or go to our website and sign up for our list for our research listserv, so you can get updates that come out on solicitations for research and on upcoming workshops like this, where we discuss what's going on. And I don't know if Meninder, if you have a response about how people can get involved in the research for CEC.
Right. Yeah, there are some ways to get involved. Like we have the technical advisory committees for our projects, in which you can be part of and be abreast about the work that's going on, and also provide your feedback as the project is going. And also we have our Healthy Equitable Energy Transition Working Group, to which I'll just add the link here as well, which provides which is a technical forum for technical discussion regarding issues at the nexus of air quality, human health, and California's clean energy transition. And we have included in that on the webpage our ongoing and forthcoming research work, so forthcoming solicitations that we'll be releasing. And also some of past list of past CEC funded air quality research. Yes, so yeah, within the projects while it's going on, we have technical advisory committees in which you can be part of. And yeah, if there's an interest, you can email me, and I'll be happy to link to the project recipients.
Great, and thanks to Kai for also putting links for those who want to apply for positions at the ARB. Another way to get
And
involved.
and speaking of links, there was a comment, a good one. Can you please put clickable links in the chat? I went ahead and did that, so you guys will have those links.
Awesome. So yeah, so I guess the question is, are there any questions on the presentation? I mean, maybe Jeff, you could just put up the slide that has or Pat, the slide that has the proposal for a moment, just so we could remind people.
Sure. Yeah, let
There's
me
a
go
lot.
ahead and put that back up. I had to take it down so I could put the links up there. But let me go ahead and relaunch that real quick. Okay, so that.
I'm seeing that there's a couple questions in the Q&A. I don't know, Kai, I'm not seeing them. Do you want to read them?
Actually, I can see them.
Okay.
Yeah, and I believe these may be directed at the projects Meninder was talking about because it came during his talk. But we might have some answers as well. What are you all using to measure NO2 levels in different studies? What testing is available to residents? If applicable, how do they access the testing?
So those are the research studies. So the research teams use a combination of real-time and integrated air pollution monitors to measure multiple indoor air pollutants at different locations in home. For example, for NO2, NO, CO2, carbon monoxide, and optical PM2.5 sapiens is used, and also measures temperature and relative humidity. And there are other monitors, for example, NVIA monitor is used, and Ogawa monitors are used for time integrated NO2 and NOx pollutants as well. I hope that answers the question. But
Okay, and just quickly, Bonnie, would you like me to go ahead and bring up those prompt questions?
Well, yeah, I was thinking mainly just of the proposal that we have.
Okay, so the approach slide, basically.
Yeah, that has the specific level.
Sure.
There is another question in the Q&A. It's, will you be including gas water heaters in your future studies as they are so prevalent in low-income housing? That's for CEC.
Yeah, that's a good question. For our 3C Beach project, as it will target multiple interventions, so it will also, in addition to retrofitting the gas stoves, we'll also look at the gas water heaters, and also measuring air quality and other metrics pre and post retrofit. So it will include the gas water heaters. But as of now, we don't have future research efforts that will look at the gas water heaters.
And I saw a question in the chat, actually, it might have snuck by. It said, will CARB be looking at benzene indoor air quality standards at any time soon?
Yeah,
Go
Jeff,
ahead,
actually,
since
I
you're doing the
answered that.
toxic stuff. Oh, you did
Yeah,
answer it.
yeah,
Okay,
yeah.
great.
We currently don't have a specific schedule, or in the case of benzene, we don't have guidelines for benzenes, but right now, we appreciate the input on what pollutants to prioritize in the future as we finish up with NO2.
Okay. So one thing is Meninder was giving his presentation. You may have noticed a name kind of pop up on a lot of those studies. That's Brett Singer, and he does a lot of work in this area. And one of the things I was wondering about was like with Sevica and some of the other studies is where are we seeing NO2 levels going? We kind of know from say a decade ago kind of where they were indoors, but are we seeing those trending down? And Brett, if you don't mind me putting you on the spot, I was just wondering if you had anything to offer in those regards.
Thanks, Jeff. Can you hear me okay?
I can hear you great.
Okay, I can get video there too if you want. Sorry about the lights in the background there, but
Oh, that's all right.
so the short answer is like I don't think we have great data yet, and it's sort of apples to apples. Well, we don't have as good apples to apples comparison. We did a lot of measurements in the past in different types of homes. So we did a study as far back as 2011 where we mailed out samplers to people, so get time integrated measurements in homes where we're targeting homes that were smaller apartments, more cooking, et cetera. And then we did new homes, and I think somebody put a reference that study up, and some apartments. When we get the data from the Civica study, that'll actually be a good, I think, a good point of comparison back to that 2011 study, 2010, 11, 12 study, which was also Energy Commission funded,
Mhm.
because I think those groups will be similar enough that it'll be a relevant comparison. And you know, the caveat is, of course, you have to account for the NO2 that's coming from outdoors as well, right? So,
Mhm.
but stay tuned is the answer. I don't have that result yet,
Okay.
but we should. Meninder said 2026 next year we should have a lot of results coming out, and we'll be able to make comparisons like that.
And the outdoor thing is kind of interesting, given that, let's say, absent indoor sources, might we expect, like, could we say back of envelope that the IR ratio is maybe around 0.5? So, say for 10 outdoors, you might expect to see 5 indoors if you don't have significant indoor sources. Is that a reasonable estimate?
Um, it's usually a little lower than that. It depends on the
Okay,
season, whether you have your windows open, etc. But like,
sure.
if your NO2 is usually going to be higher in the winter. So wintertime evenings, nighttime, overnight, winter is going to be your highest NO2. All the emissions from evening rush hour get trapped close to the ground. So you could have higher, but that's also a time when most people have their windows closed, right? Trying to keep warm. Um, and if your windows are closed, you might get numbers down around 0.3, 0.4. So little lower than what you said, I think.
Okay, thanks,
So,
Brett.
yeah, I just wanted to kind of pull this back, and we're really pleased to have so many very engaged and expert folks on our webinar today. And I just wanted to kind of pull back to what we've done here. We've had a excellent presentation on the health impacts of NO2, on the reasons for updating our indoor guideline, on the specific proposal we have in our next steps, which will be to develop a staff report on how on this update to the guidelines that will be circulated, and there will be opportunity for public comment. Also, we had some excellent presentations from our partner agencies, so we have a much better understanding now of the cooperation and the collaboration that's going on between the ARB and the California Energy Commission and the California Department of Public Health. We're all working together on different aspects of the indoor air quality issue, and the research that's been done that is currently ongoing and has been done at CEC, added to all the other research that we presented, demonstrates the high levels, unfortunately, of exposures that can occur and the health impacts that can occur from exposure to NO2. And the work that's going on mitigation is very important as we move forward to adopt a guideline. We're going to want to have as much information as possible on how we can effectively intervene and provide the health benefits of controlling NO2 levels, and make sure that we have as much information, education, and as many options as possible for communities to help control exposures. And of course, we really appreciate all the input from CDPH on the importance of indoor air quality guidelines, and that they're moving forward also to develop a basis for adopting an updated guideline on PM 2.5. So given all that, we want to just kind of focus on any additional questions or comments from all of our participants. I see one question here. How can residents get involved in research? Is there information for future studies available for us to distribute to interested residents? And I would say that one thing that everybody can do is to get on the listservs. And we mentioned that earlier, get on the listservs for the ARB. And maybe someone can put in the link to sign up for the listservs at ARB. And when you go to that list, then you can look for the research division and research listserv so you can get information about upcoming studies. Also, or upcoming solicitations and public information. Also, we have a research planning process that goes on every year where we solicit input on ideas for research. We have a 5-year research plan. Maybe we can put that in the link too. We have a 5-year research plan, which includes a discussion about indoor air quality and the general kinds of questions that we are interested in looking into on indoor air quality. So I think getting up to speed on those items and then getting on the listserv so you're notified of workshops that are coming up where we are talking about our upcoming research we do that on an annual basis. And I think Meninder went over some things also for CEC in terms of how to be informed about research. Kazu, I see you have your hand up. What would you like to say?
Yes. First of all, I'd like to thank folks at CARB to working on this pollutant. We get a lot of questions about NO2 at our department as well at public health department. And once we have a guideline or standard, that would be a benchmark for the public to understand where their situation positions. And having that benchmark, it will be a powerful tool for the people that needs help to advocate for their rights. So I'm really grateful for your work, and I hope you will keep pushing this so that it will go live pretty soon, maybe next year. So thank you for all the work.
Really appreciate that. And I see another question. How can the public access your research to hold landlords to higher housing standards? What are your plans for supporting residents and working with advocates and legal teams? Of course, this process we're talking about today is about developing our indoor air guidelines. And when we put our report out, which is the next step on the indoor guideline for NO2, there will be a lot of important information in that report about the health impacts of NO2 that we've gone over today, but we'll have it all in writing, have more references also in that report, in addition to the references that have been listed by Meninder in his presentation. So I think, looking at our CARB webpage and our CARB report, and we also have a report coming out soon, an update, a research contract that will provide an update on our 2005 indoor air quality report to the legislature. So again, if getting on our listservs, you'll be able to get notified when we have a research seminar on that update, and or reaching out to Pat and Jeff, who can get you updated on that. I don't know, Pat or Jeff, do you have any other comments on that question, or any of our panelists?
No, not for me.
Right. Yeah, like I said, just get on the listservs. We basically will be putting out our reasoning for saying these levels. And definitely people can use that in any way they want for advocacy and other work.
Okay. Kai, do we have any other questions in the chat that aren't, or excuse me, in the QA that haven't been answered?
No, not currently.
Okay, great.
All right. Well, I think I'll turn it back to you, Jeff, to close
Okay.
out the workshop.
All right,
We've had a great
great.
discussion.
Yeah, I really appreciate everyone's attention, especially at this somewhat late hour. It was a little unusual. We don't always have to, oops, let me go back here. Don't always have these at quite such a late time, but yeah, appreciate it again, everybody being here. And as far as next steps, we shared what our next steps are going to be. And basically, we're now going to move on to revising a final document and going through the basically review stage, and then hopefully looking for some guidelines published in 2025. So, excuse me, 2026. And so I just want to again thank everyone, and we will be posting the video and an update and the slides from the presentation within probably the next week or two, and we'll try to send out some email to everybody and let them know that those have been posted. So that's all I have.
Awesome. Thanks, everyone.
Okay. Thank
Thanks.
you again, everybody. Have a good day.
Thanks.
To our speakers.
Yes,
you.
and thank you to our speakers. Yes.